Hi, my name is Madison.
I'm Carrie.
And I'm Olivia.
And we did our project on spondylosis.
So spondylosis is a disease that targets the vertebrae of the spinal cord. And in humans, spinal cord and the brain make up the central nervous system. And the spinal cord is important in controlling a person's motor skills. Cervical spondylosis refers to upper back pain in the neck, and lumbar spondylosis refers to lower back pain. In a normal functioning spine, the vertebrae are connected in a way to maximize the movement in a person. But someone who has spondylosis, the vertebrae break down and narrow, which essentially decrease this connection that the spinal cord vertebrae have with each other, which causes decrease in motor function.
One of the main symptoms of spondylosis is obviously back pain. It can also cause numbness and tingling in hands, arms, in the legs in the worst cases. The doctors mainly see this disease as through x-rays. They can see the disc between the vertebrae get shortening, and they can also see bone spurs formation, which both of those cause back pain. Since it's a degradation disease, if it's not treated or helped, then it will get worse by time, just by the wear and tear. And one of the most common treatment is started with physical therapy, and if it only gets worse or is not treated right away, some surgeries are recommended.
And the cause of this is usually old age, wear and tear of the spine. It usually affects the older generation, and it has a large economic impact because in Canada, the average annual cost to treat a patient with spondylosis is 9,000 Canadian dollars, which is 7,300 US dollars.
Also, another important part to mention is Medicare deals with the older people, and since back pain in spondylosis is due to degradation of the vertebrae, a lot of older people have it. Therefore, Medicare has a lot to do with this disease, which causes more government spending towards this disease.
And also, for another treatment, it can be treated with pain medication or epidural steroid injections, and there is also surgery available, but to put a metal rod in your spine, but it's very painful, and the average age of people who have spondylosis is 50 years old, so they usually prefer not to have the surgery.
Medical professionals have also come out and said that back pain is the leading cause of disability worldwide. This is an important economic impact because it is known to be the number one most reason why people are on disability, why they can't work, and that affects government spending, and that 80% of people experience back pain at least once in their life. So clearly this is an epidemic that is affecting the majority of the population, so there needs to be something done other than a surgery or prescription drugs that's able to treat this disease.
My first ideas was lifting patients. A lot of people in the hospital, nurses, EMTs, doctors have back pain because of lifting patients all day long. One of our first ideas was a portable lifting machine to get people in car accidents or other accidents onto stretchers easier so the EMTs don't have to lift the patients. We decided to choose a back brace because it targets the whole population and more people will be able to be treated by a back brace.
So obviously the back brace was the best idea because, like we mentioned before, 80% of people have at least one instance of back pain within their entire life. It's also an inexpensive product that could be bought up by many hospitals, and it specifically, as well as improving your posture, it also is helping with this disease.
So we decided to make a prototype with a neck component, so that way we could stand out from other back braces in the market. So this was our initial prototype. We made it out of an Amazon box. We have 2 straps on the front, one on the bottom, one on the top, and this was because to hold it onto your body, so that way it would be easier to stay on. And then we had a back component. The cardboard itself, we bent it ourselves, and we used a lot of hot glue to glue this piece on. And this was supposed to be the neck component, but it ended up being, this was really the piece of cardboard being this thin and this short, what ended up not being a good idea because it just bends all over the place. It's not a very good to hold up your head. It wouldn't provide any support at all for your neck, as it just falls easily backwards. And it was just really cheap cardboard. The dimensions weren't really easy because you see like this part is about 4 inches, and then this part on the other side is probably around like 6, so it has uneven bending. It wouldn't be really doing its job as if we used the final prototype to model this. So
one of the main problems with this is there's no way to get in and out of it. We have it just hot glued, and there's no way to get in and out.
And so we decided to make this our final prototype. We made it laser cutter in the makerspace, made it out of cardboard, and we scored it right here so that way it would bend properly. And we have a 22-inch tall, 3-inch wide, 8-inch thick piece of wood that we made to connect the back to the neck. And we added Velcro on the sides, so that way, like at the top and the bottom, so that way someone can get easily in and out. You can see, like, it's pretty easy to strap yourself in. There's like an adjustment line if you wanted it to go tighter, or the Velcro does go longer if you wanted it to be looser or tighter, depending on what you needed. And then for the neck piece, we decided to add foam to it, which we used a foam cutter to cut that. Then we bent it around the cardboard so it would add more comfort to a person, as like just the cardboard itself was painful, sticking right into the back of your neck, so that wouldn't be comfortable, and it would be a lot of conflicts there.
As we were designing our final prototype, we fixed our dimensions towards Maddie's back. Here you can see the Velcro right here to tighten and loosen depending on the person's dimensions. Here on the neck, this is the piece that supports the neck, and it specifically targets the neck area and upper spinal pain.
And so with the neck piece, since we have the foam, it's providing also comfort and support for the person's head. It's very important with cervical spondylitis to target the upper neck, since that is the vertebrae that's being targeted. We talked a lot about how this would be good for people who work from home or have desk jobs, because they are helping their back and their posture while they're also getting their work done, and they're comfortable while they're doing it.
So for this back brace, our very final prototype, we noticed some future modifications that we get added to it in order to like help for the size for people. We could have like this part right here be like movable, have like little notches within like the back brace, or like have a little covering on it. So that way you can like move it up, move it down, to sort of depending on like people's sizes.
Our back brace is classified under Class 1 medical device under the FDA policy. Therefore, it does not require any evidence that it actually works and or any clinical trials. Therefore, it saves a lot of money and time for us. In order to mass produce this, we will do injection molding. Therefore, we will create a few different size moldings on the different parts, and then we can just inject it with plastic, and it's very costly, efficient, and time efficient.
So for our product, if a physician prescribes it, then Medicare would cover it, because since this disease specifically targets a lot of older people who qualify for a lot of these government programs, the government would be involved with our product.
So what we actually did for this prototype was we, developed a prototype 1, and we took the fallings and shortcomings with that prototype, and we improved upon them for the next prototype, and it was a very hands-on activity. And what we learned through this whole entire process was that the FDA is a very tedious, meticulous, overbearing process, but it is very necessary for the U.S. in order to be successful and keep everyone healthy, safe, and happy. And that it's also very expensive to develop a product, because a patent, if you want to patent it, it's $25,000, and it creates a lot of time and a lot of things you need to do, and it's a lot of money, and it's an extremely complicated process in order to bring a medical device into life. And for me personally, what I learned is I went through the whole making this prototype. I went into the makerspace. I met all the people in the makerspace. I learned how to use a bunch of the machines in the little room in the middle. I learned how to use the laser cutter, the 3D printer. I met all the people in there. I learned what safety was, how to do the air vents, the cut cardboard, what to do if it catches on fire, which it could and did happen, and just other things like that, which around UML really helped me learn more as a student and be able to further my education as well.
Since we targeted a wide population with our product, we believe that many people will benefit from this product and will buy it. A lot of people in the industry, such as physicians, advocacy groups, nurse practitioners, and even individuals will buy this. We hope that in the future, something like this will be entered into the market and us as students will help develop